Hello, this is Dr. Debayan Tarafdar. I'm an ENT surgeon and a head neck surgeon practicing in Kolkata. And this is a video regarding a kid's journey, a 5-year-old kid's journey, from my OPD to his diagnosis of chronic adenotonsillitis to the management and the outcome of the patient. Just to give you a brief idea about the case, so this 5+ year-old kid presented in my OPD with the history of recurrent mouth breathing, and he had severe snoring. So his parents complained of severe snoring whenever he is sleeping. He's not breathing properly. He always had these breathing issues, and he has visited multiple doctors in his locality, but everyone has suggested him for nebulization and anti-allergics and nasal sprays, even puffs, but his breathing issues never actually resolved. So when he visited my clinic, I actually did one single thing, that is I did a endoscopy of his nose and throat. So nowadays we have pediatric endoscopes which can beautifully visualize the nasal cavity, the nasopharynx and the throat, and we can easily determine whether there is a physical obstruction which is causing all the obstructive symptoms, all the breathing issues in a kid. So in this kid, we found that he had grade 3 adenoids and grade 3 tonsils, which are actually causing obstruction in his airway. Adenoid is a gland as well as the tonsil. These are lymphoid glands. You can see in my previous video, I've discussed about these things. These lymphoid glands are usually bigger in size when we are 2 to 3 years old, and then gradually it should regress. And usually in 85 to 90% people, the glands should, especially the adenoid gland, should regress completely by the age of 12. But in 10 to 15% kids, we do see, because of early childhood recurrent infection and other factors like allergies and all, adenoid and tonsils, they do attain a huge size, after which body cannot regress them. So this adenoid and enlarged tonsils, they just sit behind your nose and your throat, and they give rise to this kind of obstructive symptoms. First and foremost will be snoring. Snoring in any kid is not normal. If your kid is snoring, you should get him or her checked by an ENT surgeon as soon as possible, preferably with an endoscope. Second thing, the kid will be always mouth breathing because his nose will be clogged because of the adenoid which is there behind the nose. Third, he will always have recurrent cold and cough, and especially whenever he is going to lie down and sleep, you can see visible struggle when he is taking breath. You can see the struggle he is having to just take breath normally during sleep. So now we are going to show you some clips of this patient and his parents, and starting from my OPD to his diagnosis and the management and outcome. I hope you will like it.
আপনার বাচ্চার কি সমস্যা হয় মেইনলি
সমস্যা গলায় মানে গ্ল্যান্ড বেড়ে আছে,
টনসিল বড় হয়ে আছে। আচ্ছা, আর নাকের পেছনেও গ্ল্যান্ড আছে, এডিনয়েড গ্ল্যান্ডটাও বড় হয়ে আছে। ও কি ঘুমানোর সময় সমস্যা করে?
বিশাল ঘুমোতে কষ্ট হয় এবং মানে গাল হা করে অনেক জোরে জোরে নিঃশ্বাস নেয়, নিঃশ্বাস নিতে কষ্ট হয়।
নাক ডাকে কি? নাক ডাকে জোরে জোরে নাক ডাকে, শ্বাসকষ্ট বেশি হয়। ঠিক আছে। আপনার বাচ্চার বয়স কত?
বয়স ওই
5+ না? এবং ওর এডিনয়েড এবং টনসিলের অপারেশন করতে হবে।
As you can see, after the endoscopic evaluation, we have explained the parents why he was having such hard time during sleep, because he had grade 3 adenoid enlargement, he has grade 3 tonsillar enlargement, and because of these glands he was getting infected recurrently. That's why cold and cough was always with him. So after convincing the parents, we have taken up the kid for surgery. His surgery is adenotonsillectomy. Nowadays we do adenotonsillectomy with coblation. So coblation is a beautiful instrument with which we can do adenoid and tonsils completely bloodlessly, and to add to it, because of coblation, the post-operative pain is much lesser than the conventional technique. So we are going to see now a little bit of the procedure, and then we'll go for the post OT recovery and how the kid is doing now.
তোমার কি ভয় লাগছে নাকি? ভয়ের কিছু নেই, ঠিক আছে তো? চলো।
So we started the procedure with tonsillectomy. You can see tonsils being dissected out with the help of coblation, and you can also see, because of the coblation instrument, we can completely do the tonsillectomy without any blood loss. Now, after removing both side tonsils, we are going to switch to endoscopic view for adenoidectomy. Now, this is the adenoid which is almost 90% blocking the nasopharynx. This is coblation adenoidectomy. See how beautifully the tissues are being melted out with the help of coblation, and it is completely bloodless. And this is the immediate post-operative picture. You can see how much space has opened up just after surgery.
এর অপারেশন করলাম আমরা এডিনয়েড আর টনসিলের, রক্তবিহীন অপারেশন। আজকে কদিন হলো?
আজকে 9
দিন হলো। কি মনে হচ্ছে? নাক ডাকতো আগে প্রচন্ড, এখন কি মনে হচ্ছে?
নাক ডাকতো এবং মানে গলা দিয়ে আওয়াজ হতো, সেইগুলো অনেকই কমে গিয়েছে, এবং নিঃশ্বাসটাও এখন নিচে বুঝতে কোনো আওয়াজই হচ্ছে না।
হ্যাঁ, আর খাওয়া দাওয়া বেড়েছে আগের চেয়ে?
আগের থেকে একটু চাহিদা বেড়েছে। এখন ঘুমালে আর কোনো মানে বুকে যে আগে কষ্ট হতো এবং মানে খুব জোরে শ্বাস নিতে, সেইগুলো হচ্ছে
কিছু হচ্ছে না। তোমার কোনো কষ্ট আছে কি? সমস্যা আছে কি?
Hopefully you will like this video, and for more such informative videos, I hope you will subscribe to the channel and hit the like for this particular video, and I'll see you soon in the next one. Thank you.